Hello, as you all know, my name is Whitney Deason, and today I'm going to talk to you about PTSD and soldiers. Imagine having to say goodbye to your family and friends when preparing to leave for war. It's like putting a pause on your life and hoping it's the same when you return home. Well, everyone plans to come home okay, but some come home a completely different person and are affected in their day-to-day activities. PTSD is one of the top mental illnesses found in veterans. This is an important topic because a lot of people are not aware of how harmful PTSD is to soldiers and how much it affects their lives. I'm going to start out today by explaining what PTSD is, then I will begin to describe symptoms in 3 different categories. And lastly, I will talk about treatment plan options for a person diagnosed with PTSD. Let's begin talking about what PTSD stands for and the meaning of it. PTSD stands for post-traumatic stress disorder. According to Dr. Mugen in his article of Post-Traumatic Stress Disorder on October 16, 2008, PTSD is an anxiety disorder that may develop from an individual who is exposed to one or more traumatic events. During war, military soldiers are at high risk to exposure of a traumatic event, where the individual's life is in critical danger from an injury, threat to physical integrity to either the individual or to others. In order to be diagnosed with PTSD, you have to be exposed to at least one potentially traumatic event, and the individual must react with helplessness, fear, or horror either during or after the event. Now that we have an understanding what PTSD is, let's see the 3 categories of symptoms. And the first category is re-experiencing symptoms. Re-experiencing symptoms may cause problems in someone's everyday life because they start from the person's own thoughts or feelings. Symptoms include nightmares, hallucinations, flashbacks, or psychological distress, said Dr. Mugen in his article Post-Traumatic Stress Disorder on October 16, 2008. The next category is avoidance symptoms, which are things that trigger a memory of the event to the person. This may also lead to feeling detachment or isolation from friends and family.
Yeah.
This can also be a loss of interest in activities that the person used to enjoy. The last category is hyperarousal symptoms, which are usually consistent, instead of being triggered like the other two type of symptoms. Some examples of these are sleeping problems, trouble concentrating, and being startled by a loud noise or surprise. After learning about the different category symptoms, let's move on to how people get treatment for such a hard, life-changing event. The most common form of treatment for PTSD is therapy. There are a couple different types of therapy available. Some are cognitive therapy, exposure therapy, or psychotherapy. Another form of treatment is medication. According to McGregor in the article of Post-Traumatic Stress Disorder, a Mount Navy healthcare personnel following combat deployments, in 2015, the U.S. Food and Drug Administration has approved 2 medications for treating adults with PTSD, Zoloft and Paxil. Zoloft and Paxil are known as antidepressants and is used to treat depression for anxiety disorders. The last form of medication is used to treat PTSD is sleeping medicine? Ambien, and antipsychotics. Ambien is known as a sedative and can help with sleeping, where antipsychotics are used to block dopamine receptors in the brain. PTSD is one of the top mental illnesses found in veterans. Today we examined what PTSD is by first explaining the true meaning, then what the symptoms are for someone with a mental illness, and lastly I talked about the treatment plan options. Thank you for listening to my speech, and I hope I gave you a better idea of what post-traumatic stress disorder is and how it affects our troops and their families.
Right.